right, I have received an order to transfer this the patient's IV. Once they have gone through 2 liters of normal saline. So before I start, I make sure that I do my 6 rights of medication, which is right patient, right drug, right dose, right time, right route, and right documentation. So I'm checking my order. It does say saline lock after 2nd liter of normal saline. 2nd liter has already been gone through. So I will make sure that this is clamped. I will come in, make sure that my patient's the correct patient with 2 verifiers, her name and her date of birth. I will put them in a comfortable position. I will tell them what I'm doing. I am discontinuing your IV lock or your IV fluids as you were already done, and just making it into an IV lock. So I have clamped and stopped any transfusion. I will pull this out. Okay, that's done. Deal with that in a little bit. All right, I will explain to, I will make sure that everything is still patent and check. So I'll use my normal saline. I have cleaned the port. I am going in and I use 5 milliliters to flush. Yep, still good. Pull it out. Everything's good. I can throw this away in a sharps container because it's a syringe. I will explain to the patient what they need to do to make sure that this stays clean, that they don't rip it out, anything like that. My next order is the patient has been complaining about pain when they cough, so the doctor has prescribed Dilaudid, 2 milligrams IV push every 2 hours as needed for complaint of pain. The pharmacy sent me a vial of Dilaudid of 2 milligrams per milliliter. It does say to dilute it for an IV push with 2 milliliters of normal saline. So I have got a 3 milliliter syringe with an IV lure lock system. Yep. And it does say you give 1 milligram every 2 minutes for IV push, and since we're giving 2 milligrams, I will be giving this medication over 4 minutes. So I will open this. I will take my alcohol pad. I'll clean the tops. Let's put this in sight so you can see. Clean the tops. I will attach my syringe. All right. Okay. Oh, I need to pull 3 milliliters of air. Okay. I will again make sure that these are clean. I will put 2 milliliters in the normal saline. So go all the way to 1 and put the rest. And then I will pull 1 milliliter of having a hard time with this because it's such a long needle and I don't have a shorter one, so I'm doing the best I can. Okay, 1 milliliter. Okay, make sure all bubbles are gone. Go see Dada. I can't fix that right now. Go see Dada. Okay, make sure it is at 1. Again, I will get another 2 milliliters of saline. Which will put me at 3 milliliters. I will do the safety on the needle and dispose in a sharps container. I will come to my patient. I'm going to let them know what I'm doing. I'm going to give you some pain control here. So some medication, some pain, for your pain. Okay. I'm going to clean the port. I believe I need to flush. Here my flush. I opened it up. Have my flush with 5 milliliters. Flush, 5 milliliters. Done. And then I will give the medication. I will give it over 4 minutes, slowly. Okay. It's been 4 minutes. I've given it all the medication. I will flush again with another 5 milliliters. Yeah. At the same rate that I gave the medication. Okay. I will observe my patient to make sure that they're, see what kind of reactions they're getting to the medication. See how they're handling this medication. Just because it's going straight into their system, so they'll get pretty sedated. And then I have another order after this. I leave, I say, okay, I make sure that everything's close. I give them their call light, everything, they're good. Their respirations are good, everything. I give them their call light. I get another thing to discontinue the IV fusion after last dose of Clafurin. So we're going to discontinue the IV. So I will wash my hands, put on my gloves. So this is just watching me put on gloves. I put them on the wrong way. My thumb doesn't fit into my pinky. Put on gloves. I will let them know this is, we are going to remove your catheter, your IV catheter here. So bear with me. I'm going to start removing the tape. And it really likes to stick to my little pad here. Okay. Okay, I'm moving that. Get this tape here. I have a gauze pad ready. So we're just moving the dressings. Oh, my tape stuck to my little thing again. Okay. I have a gauze pad ready. And I will pull the catheter straight out and apply pressure. And then I can use this and tape over it until it stops to bleeding. Dispose of my catheter in a sharps container. Make sure that my patient is comfortable, that they have their call light, they're in a comfortable position, the bed is lowered, and take off my gloves and do hand hygiene and wash my hands. And document, make sure everything is documented correctly.